I welcome you all to our today's session on the topic Chemical Peels in Facial Aesthetics by Dr. Melwin Johnson. Earlier also, last week we had a seminar, a webinar with the same doctor on Botox fillers and on blood derivatives, and this time we are coming up with chemical peels which can be used in facial aesthetics. Now quickly I'll be introducing you to our today's speaker. Dr. Melvin has completed his graduation BDS from esteemed MUHS Nashik, Maharashtra, and post-graduation in Prosthodontics, Crown Bridge and Implantology from RML Avadh University, Lucknow. His journey towards aesthetics stems from his idea of picturing smile and face as a single co-functioning musculoskeletal entity. Right now, currently he is working and he is the owner of St. Teresa's Charity Dental and Aesthetic Center, Mumbai. So before beginning the session, I have few housekeeping notes to make. Whoever has joined us on Zoom, they can ask questions in the question and answer box in your control panel, and each and every question will be answered at the end of the session. And I request all the participants to kindly ask questions in the question and answer box and not in the chat box. And those who have joined us from YouTube and Facebook Live, they can also ask their queries by commenting, and each and every question will be taken up after the end of the session. So now without further ado, I welcome our speaker, Dr. Johnson. Good evening, sir.
Thank you.
Alright, so sir, over to you now.
Yeah, hi everyone. It's late in the evening. I hope all of you all are free now, ready to listen for some time. So today's session will be on. Can you just mute this? Thank you. So we are going to talk on chemical peels and how they are actually being used on in facial aesthetics. So many of you all might have used chemical peels who are actually into practice of aesthetics. And if you are not used, then this seminar might be a very good eye opener to begin your practice with. So when we think about peels, to a lay person, it sounds like there is a mask and then you peel it off, because most cosmetic products that we are getting in the market is of a peel off mask or a leave on mask. So they think of peels in that way. And then when we add the term chemical onto the as a prefix, then everybody is scared and wants to run away, because they don't want anything chemical to be affecting or acting anywhere on their body. So I don't know what is this problem with people ki chemical kuch hona nahi chahiye. That is their first line that they use, but everything and anything and everything that we are using as products has chemicals, right? Right from your toothpaste, it's a chemical, to the cements you used in dentistry are chemicals. The drugs that you eat, for even paracetamol, is a chemical. So I don't know what people's aversion to chemicals are. So moving on to the topic. So we need to understand that the peels that we apply are on the skin, and I will be limiting this seminar to the face alone. So we need to understand a little bit about the skin. So before that, I hope we are all dentists here. I don't know if there is any other medical practitioner who is here. So we need to understand that the skin is the largest organ in our body, and our dermatologists are the specialists in understanding skin. As I have mentioned last video also, that skin and hair is their domain. So it would be better for the beginners to actually start their practice with either milder products, or if they want to go on to a medium or a deeper or a stronger products, then they should do it under the supervision of a dermatologist. Okay, so moving on. So skin is a dynamic organ and it sheds every day. You know, we have different layers of the skin, and those layers are stratum, corneum, granulosum, spinosum, and basal. And below that we have the dermis. So first we have the epidermis, and then we have the dermis, right? So what is chemical peeling? I don't know, many of you may have the idea of what it is. So it is a type of exfoliation. Okay, so everybody exfoliates at a certain pace. So when I explain it to my clients, we are just speeding up the process of exfoliation. That is what I tell them. Okay, at different levels, we are just speeding up the process of exfoliation. So there are other terms that we can use is chemical resurfacing or chemexfoliation. Okay, usage of certain agents that are applied on the skin, left for certain amount of time, and then neutralized off. Okay, so basically mostly the agents that are used are mild acids. So like other things, this is also something of a controlled injury that we are inducing on our skin. It's a controlled injury, and depending upon the depth of that injury, we classify the peels. So they are classified as very superficial, that is affecting only the stratum corneum. A little more superficial would go from the entire depth of the epidermis. Then there is a medium depth peels, and those are the very deep peels. So medium depth, they come in and around the reticular dermis, and deep peels, the very deep ones, they go to the entire depth of the reticular dermis also. So superficial peels are the very light peels. So uh, in the very beginning of my career, I used to be very scared of using chemical peels. So I started my aesthetic journey with the at the peak of the mountain, and I used to come down the. So I started with Botox and fillers, which everybody learns or starts practicing at a very later stage. Then then I came on to PRP, which is the next in ladder, and then in the very end I went on to peels. So for the others it is the other way around. They start at the very bottom of the peak, I mean of the mountain, and they reach the peak. So at the very bottom of the mountain is the peels, because they are very easy. Okay, and they are very easy to perform, and the side effects are very minimal. Even if you see any side effect, it is very easily manageable. So peels, they begin at the very base of the mountain, so it is very easy to perform. As a koi even non doctors, although they are not legally authorized to perform peels, many non doctors are very performing peels very excellently. So when you go to these chain clinics, where they have the aesthetic clinic in chain, I'm not mentioning any name. So we don't have doctors everywhere. Doctors cannot reach everywhere, and of course they cannot employ doctors at each and every outlet. So we have these technicians who are trained in using the medium to the superficial to medium depth peels. Of course, the very deeper peels like TCA or a phenol peel or a salicylic peel for acne is not used by these technicians, but the mild peels, that are the gel based peels, are used very well by technicians. It is not ethical, but they do use it. Okay. So superficial to very light peels, the injury is limited only to the stratum corneum. That is a very superficial layer, and it creates a mild exfoliation. That exfoliation you will not even able to see or visualize. It's at a very microscopic level. Okay, so generally it gives only a mild glow to your face, and there is no much irritation or side effects that you can experience by a superficial to very light peel. I will also let you know that a superficial or a very mild peel is present in many skincare products. So if you go to read their contents, if there is an AHA or a BHA, that is alpha hydroxy acid or a linoleic acid or any other acidic content that is mentioned in the ingredient section of the product that you are using, that means you are doing a peel on your own skin. So there is nothing to panic there. I'm just informing you. So AHA is 10 to 15% TCA. I wouldn't classify it in superficial or very light peels, but yeah, for the sake of mentioning, the percentage also varies between peels, and a percentage can give you an idea whether the peel is going to affect you at a superficial level or whether it is going into a moderate to very deep levels. Tretinoin, that is an analog of vitamin A. It's an isomer. And salicylic acid. Again, I would not classify this into a superficial peel. This can range from a superficial to moderate depth peel. Okay. So going on, superficial light peels. Okay. Injury to the entire dermis down to the basal layer stimulates regeneration of fresh or new epithelium. That is 70% glycolic acid. Okay. So here there is a catch, 70% glycolic acid, but you have to add a very thin coat. Okay. If you apply a very thick coat, then definitely that exfoliation goes deeper and it no longer stays as a superficial light peel. So uh, when you go to do a peel, the content that I mean the quantity that you are using on your skin also matters with some peels. Okay. So Jessner's solution is a combination of resorcinol, salicylic acid, lactic acid, and ethylene. So that is in varying proportions of percentage. I don't remember it exactly, but you all can check it online. There is also another very similar solution called as modified Jessner solution. So this solution is mostly used to control acne. Okay, so acne breakouts. Again, here I would like to mention that if you do not understand what kind of acne that you are encountering with, because there are different grades of acne, a mild to moderate breakout is what comes under our domain. If you find the acne is cystic and it is having a lot of pus, and you understand that this is a little bit outside your domain, feel free to refer that patient to a dermatologist, because they will be a better person to identify what kind of acne it is and what kind of medications that can be followed after. Don't directly jump on to a case and get excited and then mess it up, because the entire blame is on you. If you spoil your patient, the blame is on you, and you should be well equipped with treating and managing whatever complications that you are facing in your clinic. 20 to 30% TCA, again this is not a superficial peel. Okay, so a medium depth peel, the injury, or the to better keep it as a controlled injury, because whatever peels that you are doing has to be in your control. If it is not in your control, then that injury is an injury, it's a proper injury. So you always mention it's like a controlled injury. The damage that it causes to the skin is under your control. You are damaging it at certain levels, and you expect the skin to resurface or to heal. Okay, whether it is acne or it is hyperpigmentation or certain spots or melasma or whatever, or you are just treating it for a glow, a proper exfoliation, or you are treating it for certain scars that have been left by acne or pigmentation that has been left by acne. Okay, so what you see when you do a peel, in short, you can see that in the initial days, there is an epidermal necrosis, then there is papillary dermal edema, and then there is lymphocytic infiltration. These are all signs of a mild inflammation after injury, right? There is nothing of a rocket science, and if you understand what is an injury, you will understand how a peel works. Okay, so all these are just manifestations of a controlled injury that is taking place. Yeah. Then the examples of medium depth peels are 35% TCA, Jessner's plus 35% TCA, and 70% glycolic acid. So glycolic acid is TCA stands for trichloroacetic acid. Jessner's is a combination that I mentioned. Glycolic acid, again, I told you that it is available in different percentages. Every peel is available in a different percentage. Okay. So whenever you do a peel to a client, the most important part is to check his skin, whether it is a dry or an oily or a combination skin. This comes with experience. I understand we are dental practitioners and we wouldn't be able to identify the type and quality of a skin at the word go. Okay, I understand that. When I ventured into practice, I was a newbie to the skin too. So I used to watch videos, I used to listen to seminars of different doctors. Okay, I am thinking of y'all as what I was a few years back. Okay, so I understand that understanding the skin is a little bit difficult for us, but still we can make an attempt to understand what kind of a skin is just by looking at it. It is no rocket science to understand whether a skin is dry, whether a skin is oily, or whether a skin is combination. It's very simple. If you just rub your finger on the surface of your skin, you will understand what kind of skin you have. In the same way, you need to understand the other person's skin, and depending upon the type of skin that person has, you can go with the percentage and type of peel that you want to do. Okay, so for example, if it is an oily skin, oily acne prone skin, so what you can do is you can try and control the sebaceous secretion on your face, that is the oil on the face, and you can go ahead and do a sally peel, a mild sally peel, to control the breakout of acne. But then again, you need to go back and identify what is causing the acne. Is it a hormonal acne, or is it an infectious acne, or and at what grade the acne is? Stage 1, stage 2, or is it a cystic acne, or it is a multiple cystic acne? So you need to be very careful at identifying what kind of uh, client is in front of you, what are his or her expectation, and what treatment plan that you need to make to give the best results. Okay, and deep peels, these are phenolic peels, or a TCA that has a percentage of above 40, I mean above 50%, is called as a deep peel. So a very huge disclaimer, it is not mentioned here, disclaimer, 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 don't go for deep peels in the very beginning of your aesthetic journey. I would say you reserve deep peels after you have done at least hundreds of uh, mild and superficial peels. I'm sure even in those 100 clients or patients that you're doing, you will see some of the other uh, side effects of peels. And when you learn to manage those, is when you know gain confidence and you understand what kind of a skin is, and then you can go ahead and do deep peels, right? Again, I would like to mention here that it is not our domain. So if you are ever in doubt, please don't hesitate to consult a dermatologist, or the best thing is to work under a dermatologist to understand how a peel goes. Okay, combination peels is the in thing. Every peel that I do these days is a combination peel, because there's no single uh, one size fits all solution nowadays, because the peels that are coming commercially available today are a combination of many things. So it is not only affecting one kind of a problem. It's not tackling only one kind of problem, but a multiple type of problem. So they are in very varying small quantities that these combination peels are, and they tackle a majority of the problems. So it helps in reducing the side effects to some extent, but then that doesn't mean ki you can be very careless with peels. Okay, so I have experienced issues with even 10% peels. Does Tca peel be can give you a rash or a red spot, or it can even lead to hyperpigmentation. What is hyperpigmentation? So a dark skin individual or a light skin individual, if the patch of skin becomes darker than what it was before, that is called as hyperpigmentation. So again, that all depends on a lot of factors, the depth and type of peel that you're using, and also the home care of that patient or client. So you need to be very careful while you're giving or assessing what kind of patient you have. Aditi, I hope I am audible. Hello.
Yes, sir, you're audible.
Yeah, okay, okay. So you need to understand like what kind of peel that you are using and what kind of an effect that person have. So if you are in doubt, if the patient says I've got extremely sensitive skin, I react to an n number of products, and I am very skeptical about using new products on my skin. I don't want you experimenting on my skin. If he or she is very skeptical of going ahead with treatment, then I would advise you to do a patch just below their neck. Okay, just under the neck or below the chin, just do a small patch and let it be for like 1 or 2 hours. Very I mean For a specific amount of time, not 1 or 2 hours, sorry. So that depends on the type of peel. Okay, so if the peel is to be left only for 3 minutes, then don't leave it for 1 or 2 hours. I meant to say for a specific amount of time, so that if he or she develops any reaction, so it would be at a very small patch of the skin. It won't be on their entire face, so you will be saving a lot of trouble for yourself and others. Okay, so AHAs are the most common type of peels that are used. They are very they are derived from natural sources. But then again, if they ask that is this 100% natural, so the answer is no. And if they are continuing to persist that I don't want to use chemicals, so ask them to stop using toothpaste, or ask them to stop taking medicines for fever, cold, because all those are chemicals, right? So glycolic acid is derived from sugarcane, crushed sugarcane, or processed sugarcane. Lactic acid is nothing but it is a derivative from milk. Citrus fruits have citric acid or ascorbic acid in them, that is vitamin C. Phytic acid is from rice. Okay, so the depth of injury in AHAs, especially alpha hydroxy acids, is depending on the concentration of free acid. Okay, that is the percentage, the volume applied, like how many layers of acid you are applying. So I'll tell you what happens. So whenever there is an there is a weak acid that is applied, so acids always react, right? And why they are reacting? Because the surface on which you are applying acid is a neutral surface to the acid. Okay, for example, if the acid is around a pH of 4.5 to 5, okay, your skin is at a pH of 7. Okay, so always the acid tends to neutralize itself, correct? I hope we are agreeing here. It's a little bit of chemistry. So when you apply more amount of acids, there are more free radicals for it to neutralize. Okay, so it goes deeper. That is the science behind volume applied. So as I said in the very beginning, you need to be careful about the amount of peel that you're applying. Okay, and the duration of contact. Of course, if you leave it for, if the specified time is 2 minutes and you leave it for 3 minutes, definitely you will see, you will face its outcome. It can be good, it can be bad, it can be ugly also. So glycolic acid, it is the most commonly used. It has many concentrations. There are so many brands of glycolic acid that is present in the market, ranging from 2% that you can give it to the patient for use, to 10%, 15, 20, 30, 40, 50, 60, 70% glycolic acid also I have used. Okay, so some of these products have to be neutralized, so anything ranging above 15% glycolic acid, you will have to neutralize it. You cannot give the patient to use it, but some of them are using it again. So you apply it. So I'll just explain how it is done also, side by side. It is mentioned ahead in the lecture. So what we do is we start with the cleansing of the face. Okay, so our face has a lot of oil or grease or secretions, then it has a lot of debris or pollutants that are stuck to our skin, so we clean it, like with the help of alcohol swab, and then we degrease it with a degreasing solution. Degreasing solution can be anything. Okay, it can be acetone, or it can be, what it's called, there's something that women use to remove their excessive makeup. So it is one of those things. You can use an alcohol swab, or you can use a cleansing solution and clean the entire face. Basically, you need to get rid of the excessive secretions of oil, some layer of stratum corneum. If there is a lot of dead skin, that you can exfoliate just by scraping it off. Okay, then what you do, you take a brush. Okay, that brush which we use for painting. There are specific brushes for peel applications also. you take a brush, you dispense the required quantity into a non-reacting glass. You have seen dappen dishes, so you can dispense it into your dappen dish. You shake the bottle first, because sometimes what happens, I have experienced this, that you get pre-mixed solution of peels, even the ones you buy, even the expensive ones. What happens with time, what happens, the concentrate of that solution comes to the bottom of the bottle. So you need to shake the bottle before using, and then you dispense the required quantity. Do it away from the patient, because you want to avoid spillage at any cost. You don't want to spill it into the patient's eye or nose or mouth or whatever, because it's, first of all, it's messy, second, it's dangerous. Okay, so dispense the required quantity, take a brush, and then apply a very thin layer onto the areas that you want to treat first. Okay, so there can be some patches of pigmentation that you need to apply first. You can apply more there, and then you can go on to apply a very thin layer onto across your face. I'm just talking about glycolic acid here. Then you can wait for some time. Okay, that doesn't mean you apply the peel and go out of the room and come after 3 minutes, as it is written on the bottle कि 3 मिनट के बाद rinse करो. नहीं, ऐसा नहीं करने का. You need to stand, uh, after doing a peel, you need to stand at the head of the patient. You need to see if there is any redness, or if the patient is feeling itching, or if they are feeling a burning sensation. A mild burning is expected, but irritating burning is not expected. So you need to be very careful. And if you see any kind of an ill effect, okay, then you need to neutralize the peel faster than what is recommended on the bottle. So don't always go by the book. Use your common sense. Uh, okay, so these are all small tips that I actually gathered on the way. Nobody told all this to me. You all are lucky to listen to all this. So I always learned from my mistakes. So don't repeat the mistakes that I have already made. Okay, so be careful in what you are doing. And okay, so there are many neutralizing solutions available in the market. So I would recommend you to buy those, but don't directly you spray uh, a neutralizing solution directly onto the peel applied. First, try and remove it with cold water. Okay, water is the best neutralizing solution. So sometimes I don't even use a neutralizing solution for most of the times, but sometimes when there is a lot of burning, so after removing it with cold water, I spray a little bit, I dab it onto a cotton, and then just I take it on a cotton and then dab it on the skin wherever there is a lot of burning. So so acid alkali reaction is what takes place on the skin too. And if you apply a neutralizing agent directly without actually removing the peel, I mean the acid, with a cotton and water, then the burning sensation will actually increase, because you are actually doing a reaction directly onto the face of the patient. So be careful there. So don't follow everything what is mentioned. So try and use your common sense, and you know be little careful and wary. Even 10% glycolic can give severe burns to the patient if you are not careful. Or if the patient has reported allergy, then you have to be extra careful. Do a patch and prevent yourself from getting into trouble unnecessarily, because there are troubles that you cannot treat. Okay, you fall into a ditch that you can climb out of, right? If you can't climb out of, you have to ask help any which ways. So moving on. So, what are AHAs? I have already explained again and again. So, this is just another repetition. So, it helps to improve the skin quality, in short. Okay. So, whenever you have some mild aging signs on your face, AHAs can improve your the aging that has occurred on your face. It can regenerate a little bit of collagen back onto your face, and it can make you look younger and fresher. It can give you that mild glow that you require just before going to parties. So it can be called as a party peel. But then again, you need to be careful. ये नहीं कि 2 घंटे पहले 2 घंटे बाद पार्टी है और तुमने पील कर दी और पेशेंट का फेस जल गया. So be careful there also. See, I'm not trying to scare you. What I'm trying to say is that be wary of what you are doing. If you are in doubt, do it over here on the palm or do it just below the neck of the patient and see how he or she is reacting. Okay. uh, Especially women are more sensitive. Men have a thicker skin, they have thicker keratinization, more keratinization, so the side effects of peel in men is much lesser than what women have. But women take, so on the other side of the coin, women take good care. Their post care is extremely good. Men don't take care, they don't use sunscreen. uh, मैं खुद भी भूल जाता हूँ, तो उसमें कोई बड़ी बात नहीं है. If a man forgets to wear sunscreen, और क्रीम वीम की आदत नहीं है. I don't know about the current generation, but uh, the men of my generation who are listening today can understand what I'm trying to say, right? So BHA or beta hydroxy acid, that is a salicylic acid, that is used either alone in the form of a liquid, which is in itself very potent, or it can be used in a gel form, which is less potent and causes less effects, or it can be used in a Jessner solution. It's a combination. So salicylic acid is used mostly to control acne. Okay. So what it does, it's that it exfoliates the pore and it helps in reducing your sebaceous secretion. So if you find that your patient has an extremely oily skin, and because of that excess oil, his pores are getting blocked and he's getting some kind of an acne situation, then it is a good idea to, add salicylic peel regimen to his overall treatment plan. Okay. uh, Again, treatment plan banana itna आसान नहीं है. Till date, I go and refer dermatology books. I have two very close dermatologists who are my friends. I keep asking them ki what all do I need to do to treat that particular patient, because I'm a prosthodontist and you all are all dentists. It is my passion to do dentistry, but I like, thinking of the face as a whole is my dream. पूरा चेहरा मेरे को ठीक करना है. तो uh, you are doing a lot of procedures into the oral cavity. You are doing complete dentures, doing implants, you're doing veneers. Okay, I understand that because this is our domain, right? So we need to, draw a line and understand what all can we do. If things go out of hand, the problem will be yours. Okay, and you're the patient you're treating. So if you feel that you are knowledgeable enough and you have that kind of an experience that you can handle your case, I'm sure many of the friends who are listening to me today, or few of them at least, have a very good idea of peels. I know dentists who are performing extremely well in the peel category. They are doing a marvelous job. I have seen their before afters, and the level of skin quality that they give to their patients is, if not better, at least on par with, many of the dermatologists that I know. So I have worked in close association with a lot of aesthetics, I mean dentists who practice aesthetics, with dermatologists, with plastic surgeons, and compiling all the treatments that they provide, and the level of results that they are giving is really marvelous to look at. So uh, take one step at a time, take baby steps and track your progress. I'm sure what you are today and what you are 1 year after, you yourself will, call me up and say ki, yes, I have progress. Earlier I used to not understand what skin is, but today I have some idea what it is, right? So yeah, be careful. So yeah, so BHA gives a type of whitish discoloration when you apply on it. So it is called as pseudo frosting or false frosting. Frosting is some kind of chelation. Actual frosting is a chelation on your face, but pseudo frosting is not that. I mean the frosting or the whitish color that comes onto your skin after BHA is just an indicator that uh, those areas the peel has been absorbed, the other areas need more application. So that is only that much, so you don't need to be very scared. But try and limit your applications to not more than 2 minutes. Okay. So there is something called as Spot Sally that I follow. So Spot Sally में क्या करता हूँ? I do a general glycolic peel. This is just I have taken this idea from another person. So it is not my independent, my idea. So what you do is you do an entire glycolic on your face, and then wherever you have those acne, not severe ones, be very understand that these are only one or two pimples that you get on and off. So just on those spots you can apply with a very thin brush, you can apply salicylic peel, and it gives you very good results. Okay. Jesner solution, as I mentioned, is a combination of resorcinol, salicylic acid, lactic acid, and ethanol. There is nothing more to explain in this. It is used in various types of acne. Again, whatever I said, again, it's repeated. So you don't need any kind of neutralization in it. But again, if you see that there is a lot of itching, irritation, or redness, you need to be ready with your, your neutralizing agents. So TCA peels, whoever is in the beginning of their journey in facial aesthetics, I wouldn't recommend you all to start using TCA peels on the word go. Don't be overexcited and go on to use a TCA peel. You will end up injuring the patient. You will end up injuring the patient. So be careful while using TCA peels. They are liquid peels and their penetration is very quick. Okay, and the problem is also the problem is also little not manageable. You can end up with severe burns with TCA. So be careful with this type of peel. I wouldn't recommend the beginners. Even the seniors or the ones with experience with a lot of peels do go wrong with TCA. So I have seen a condition where a very experienced person, dermatologist only, did a TCA of the arm of the patient, this hand, and right in front of me there was lysis of his skin, and his entire skin just peeled and fall off. You know. So again, I'm not trying to scare you. I'm just आपको बस आगाह कर रहा हूँ. आपको लगता रहेगा ये is some kind of show these people do on the screen, like what's it called, सीआईडी के साथ जो होता है सावधान इंडिया. सो ये सावधान कर रहा हूँ तुमको, मैं आपको डरा नहीं रहा हूँ. Just be careful with what you are using, because every instrument that you have in your practice is like a weapon. Okay, just in our terms, think of it like, you're injuring the patient's gums with your aerator burr. How serious can that get? In the same way, a peel which sounds very simple and easy to do can go wrong, horribly wrong. I have seen things going horribly wrong with peels, and the after effects of that is very serious. And to help a patient with peel burns is very difficult, and he or she comes in with one problem and goes out having 10 problems. So be careful. TCA, again, it's all a repeat. So the way of doing it is the same. Degrease the patient, clean, dispense into a small dispenser. Take little bit amount, apply. You can do a patch test right before the peel and then use it across wherever you want to use it. Again, there is no need of neutralization, but be ready with neutralizing agent immediately if you see any kind of a redness or erythema that you see. Deep peel, again, for the beginners, don't do this. For the experienced ones, it is a combination. Phenols are other products that are used on the skin, which gives a histological injury to up till the reticular dermis. So these are very deep peels. Uh, I'll talk about some other type of peels with the brand name also. So I'm not endorsing these brands, but I found them to be very helpful in my practice. So I keep glycolic and lactic peels. I do keep salicylic peels from a company named as Sesderma. They are excellent peels. Okay, safe and gel based. The side effects are much less. I use a black peel from Akar, and for a moderate to deep penetrating peel and a very safe peel, like I till date I have not experienced any side effect, is a yellow peel from Aesthetics. They it's a combination peel. The depth of penetration is from moderate to deep depth. Also, there is another brand called as Cosmelan. They are deep peels. So the depth of penetration is up to the reticular dermis. The peeling, it can last anywhere from 1 week to 10 days. So the patient has to remain indoors. So this lockdown scenario is a very good excuse to get deeper peels done. So many of my clients who are actually working from home and don't need to do video calls like me are going in for moderate to deep peels nowadays. Okay, so indications is very simple. Anything from nothing, no indication, but still you can do a peel for glow. So there's no indication, but still you want to have that feel good. So you can go for very superficial peels like vitamin C peel, or you can go for a glycolic mild 12 to 15% wala lactic peel, or you can go for an under eye peel using arginine. RG peels are also available. So they are very mild to moderate peels. To photo aging and wrinkles, pigmentary diaschromias, that is hyperpigmentation or any kind of pigmentation, or any skin, if you have a general skin and your one part of your skin is slightly dark or light, you can go for peels. For skin diseases like acne, actinic keratosis, and lentiginous. So again, a deep thorough knowledge of these conditions are a prerequisite before you go on to treat them. And if you don't have the knowledge, then don't do peels. Okay, so if you don't understand what is melasma, don't go with melas peels, or don't go on to treat them if you don't know about them. First of all, again, just to be cautious, you need to have a thorough supervision before doing the deeper peels. It is better in the beginning to do it under in the supervision of a dermatologist, diploma or MD, and after that you can incorporate into your practice. That is my suggestion. Contraindication of chemical peels. So again, just like any other treatment, if a patient has unrealistic expectation कि मैं काला से गोरा या गोरा से काला बनूंगा, then peels are not for you. Just send them back and tell them कि there are many people who are doing this, you can go to them. So if the patient is non-compliant, or if he or she refuses to use aftercare, so after peels your skin become little sensitive, so you need to use sunscreens, and moisturizer and night creams. So you need to be little careful with such kind of patients, and you need to be, if they say that I do not use sunscreens, or I just refuse to use, just do the peel and get it over with, so you refuse such patients. Okay, if there is an active infection going on, if there are if he or she has done waxing or shaving the same day, you cannot do, because the skin is already irritated and you are adding even more irritation. Aditya, I hope I am audible.
Yes, sir, you're audible throughout.
Yeah, so if there is any history of the patient taking isotretinoin, so isotretinoin is a vitamin A analog that is used to treat acne. Okay, so it shrinks the sebaceous glands. It works in that way, and it makes your skin dry, and that is how you get rid of acne with the help of isotretinoin. It comes in 10 5 mg, 10 mg, 20, 40, like that, and so on. So such patients have very sensitive skin already. So if you are doing a peel on them, it might lead to burns. So we need to be very careful. A thorough history of the patient is very important before you go on to uh, do any kind of a procedure on them, especially on the skin. Secondly, if you see a very irritated skin, when you look at some person and you already see some red patches on their skin, he or she might have an underlying skin condition which is difficult for us to diagnose. I understand we are all dentists here, so it is better to avoid peels in their cases. So it can be psoriasis, or it can be any kind of a skin infection, fungal, bacterial. You don't understand that, so it's better to not do a peel in that case. So if they have a history of keloidal tendencies, so avoid moderate to deep peels. क्योंकि अगर केलॉइड बन गया तो उसको ट्रीट करना बहुत मुश्किल है. Okay, so you cannot do peels even in cancer patients because first of all they are on immunosuppressants. Secondly, they might have underwent radiation therapy or chemotherapy. So in all these conditions, you cannot do peels. Also, try and avoid peels. Try and avoid any kind of treatment if she is pregnant. If a female patient has pregnant, because none of the drugs are actually being tested for if it crosses the barrier, the barrier between the mother and the fetus. If it affects the fetus, we don't understand that. Also, if you are prescribing creams, be careful not to prescribe vitamin A or retinol if the person is pregnant, because retinol or retinoic acid or products that contain any kind of vitamin A analog are teratogenic and may lead to birth defects. So be careful in what you're doing. So I have just explained you how to apply a peel. It is very simple. Uh, we'll just go on with the slide. So consultation is very important. Discussing the procedure is an essential step for setting good realistic results. So if the patient expects कि fair and lovely की तरह वो निखार आता जाएगा with every session of peel, then you don't do that, क्योंकि such a thing doesn't exist. Glow and lovely, fair and lovely, all that is bullshit. It doesn't happen like that. It doesn't work like that. So proper preparation, preparation is, you are actually, uh, before giving a major exam, you are prepping yourself. So in the same way, before going for deep peels, we need to prepare your skin. Okay. So that you can do with the help of tretinoin creams or retinoic at night, and hydroquinone and sunscreen in the morning. Okay. So if he or she has a history of herpes simplex around, or fever blisters that they call, then you can go in for a prophylactic dose of acyclovir, but that is all optional. So it's called priming. So you do one or two light peels. If supposing you have planned a yellow peel, what I do is, if I planned a yellow peel that is a moderate to deep peel, or a phenolic peel, or cosmelan, so 1 month before I start doing mild peels on your skin to see if there is any kind of reaction. Also, it develops a kind of bond between you and the patient. And while doing that, you will understand how much of a toleration level the patient's skin has. Okay. Also, you get some level of understanding कि patient का expectation क्या है. Okay, if you keep talking to the patient, something you will say, something he or she will say, and you will understand, you know, what is their expectation. So, and depending upon that, this is true for all kind of treatments. So unless you don't speak to the person, you will not understand what kind of expectation he or she has. Okay, so there was this patient who was a chronic periodontitis case. Okay, and he had a lot of calculus deposits across his oral cavity. So I make it a point to inform him or her, whoever has chronic periodontitis. People generally get very excited and start their scaling and routine prophylactic cleansing of their cavity. So I don't know if periodontists they'll agree with me or no, but it is better to inform the patient कि बहुत सारे दांत आपका bone support चला गया है, and maybe after scaling some of your teeth will start shaking. Okay, so rather than for that 2000 rupees for your scaling, it is better 2000 or whatever your rates are at your clinic. It's better to inform them prior than to listen to from them. I am sure everyone in this group has faced this problem. Aditi, have you faced this issue?
Yes, absolutely, sir. Every now and then, a lot of cases with severe periodontitis, generalized periodontitis, they come up, and we need to explain them that if we do not come to me after once you feel like your teeth are shaking, we have to explain this to them.
Yeah, so it is better to actually inform them and take a prior consent कि ये things can occur. If you are okay with that, then we'll go ahead with the treatment. Otherwise, let us stop here and now.
So
Right?
we have a consent form with us, so we just get it signed with by the patient and his attendant, and we write
Exactly.
each and everything like this might happen, that might happen. So we write all the possibilities that might happen with our treatment after the treatment, and what all we can do. You know what all options we had for the treatment, like even if it is a scaling, a simple procedure scaling,
Yes.
not just
You need to
extractions.
inform them.
Yes, absolutely.
So moving on with what we have at hand, थोड़ा सा deviate हो गया था. So consent form, like it's very, very important. Just like in every other procedure we do, it is very important before performing peels also. So we need to inform the patient that there can be a number of, if I read a consent, I do not have it me right now. I have mentioned so many things that out of 10 patients, 1 or 2 do not do the treatment. So don't worry. कुछ घबराने वाली बात नहीं है. पहले तो उनको काउंसिल करो कि there is nothing to worry. These consent forms are scary. They are meant to be scary. Okay, because here you are trying to save, I'm sorry for my language, you are trying to save your own ass. Okay, you don't need to get into a situation where you have nothing for you. वैसे ही डॉक्टरों की हालत खराब है इंडिया में. ठीक है, कानून तो कुछ नहीं करेगी लेकिन पब्लिक जरूर आके मारेगी. So to save yourself, you need to tell everything to the patient. अरे डॉक्टर आपने सफाई कर दी और सारे दांत हिलने लग गए. ऐसा सुनने को सबको मिलता है. आई एम श्योर at some moment of your career you will listen to this. या तो आपने सफाई कर दी, सारे दांत में सेंसिटिविटी हो गई, पहले नहीं था. तो you need to prepare the patient, and if you find that the patient is troublesome or might cause or is a very fussy person, then please avoid such people. You know, patients bhatere hain. There are a lot of fish in the sea, and if you believe in your work and you have that quality in you, you know that you can deliver good results, then 1 or 2 don't matter. Let them go. Don't think about the money. Think about delivering good results. Money will follow. Okay. So examine the skin, as I told you. Oily skin combination, dry skin, thin skin, thick skin. Just it comes with practice. Safety precautions, always check the label, check for the expiry. क्योंकि expiry अगर खत्म हो गया तो the potency of the peel is either reduced to a good extent or increased by a very huge extent. So that will become outside your, you will expect there is no peeling and it, peels very heavily. Always write the date of the prepared formula on the bottle. So this is not for the ones we are getting in the market, because they have a very good, an even solution throughout. But still, you make it a habit to check the manufacturing and expiry date. So they are mostly good at 12 months from from manufacture mostly. Always shake or tilt the bottle before use. As I had explained, the with even very good brands, what happens, the concentrate, it comes to the bottom because it is thicker or heavier, and upar sab light stuff hai. So you will keep dispensing and there's nothing, and when there's little bit left, and you'll end up burning the patient. So this has happened with me. I forgot to actually, I started shaking after experiencing this. So it is very important to you know tilt the bottle up and down before doing anything. Please ask the patient to close their eyes during the procedure. Watch for tears. Never pass an open container over a patient's face. That is very common sense. So avoid topical anesthetic creams. It's not required at all. Do not peel the eyelid as a beginner. Not only as a beginner, for everyone. इधर तो कुछ करो ही मत. Don't do it. It's not required. So even if they insist कि यहाँ पे करो, आपको नहीं करना है. Because patients will insist many things. ये भी कर दो, वो भी कर दो. They are dumb. They don't know. I wouldn't say they are dumb. I would say they don't know. Okay. So मेरे दिमाग में dumb आता है, but I didn't mean to say that. They do not know. So there are many doctors whom I have seen who paint a very rosy picture about themselves. The clients they have are all very top notch. I have clients who are working in TV serials, बहुत बड़े actor actresses नहीं है, but still they have expectations like there will be a dramatic and a drastic change in their face. Okay, and they keep pinching me to do things that I'm not comfortable with on their face, I mean to say. So they यहाँ भी कर दो, वहाँ भी कर दो, ये भी कर दो, वो भी कर दो, इतना कर दो, यहाँ कर दो, and they try and teach me what I have to do for them. Okay, so you better be very stern with such clients or patients, and you try and explain that I am your doctor and let me decide your treatment plan rather than you dictating me what to do for you. So if they are okay with that, very good. So many of these top shots, they come with a lot of pride and ego, and after speaking to speaking to me, half of them don't want to take treatment from me. So I'm very happy to let them go. So I don't know. I am just giving you my suggestion of what I feel about such people. So it is better that you be the judge rather than them forcing you to do something that you are not comfortable with. I hope you're getting the point. Rubbing using gauze is better than painting. I don't agree with this line. I go for a brush and I always do with a brush. So gauze se better mujhe to brush lagta hai because the control is much better. Apply to small dark areas first and then to the whole skin. Continue to the hairline. Extend for 1 centimeter before the jawline. So just go beneath the jaw. That's what you're trying to say. Patient lies in 45 position. It's okay if they lie supine also, no problem. Cleaning vigorously with alcohol and acetone removes residue. It's not necessary that you clean very rigorously and you end up burning the skin before even doing the peel. So a light, gentle cleansing and exfoliation is also enough. Degreasing is important. Use cotton tipped applicators or gauze pads. You can even use a brush. So examine the face and weight. So there are many peels that you have to do it and neutralize it on the spot, like after 2 or 3 minutes. There are many peels that are leave on peels. So leave on मतलब ये नहीं कि छोड़ के फिर भूल जाओ. Leave on का मतलब ये है कि पील लगा के छोड़ो, 6 या 8 घंटे बाद उसको पानी से धोना है. Right, so you need to explain to the patient to keep an alarm because many of these patients, they forget, they in their life, just like everybody else, they forget washing their face and they end up with a lot of side effects. Sorry. So so after doing a yellow peel or a deep peel, I always suggest them to keep an alarm for 6 or 8 hours, so after which they need to clean their face with water, and they are supposed to avoid soap on their face or face wash or any night cream. They are only supposed to use moisturizer or sunscreen. This is all from experience. Frosting, I have already explained what it is. So what all can a patient experience just immediately after a peel? So there might be slight tingling sensation, a pricking sensation that occurs immediately after applying a peel. Immediate burning with the peel is normal, but if the burning is extreme, you need to be careful. A cool saline nahi chahiye, you can use cool water also. Sodium bicarbonate after glycolic acid, not immediately. First try neutralizing with cold water. 90% of the time उसमें solve हो जाएगा, but still if there is some tingling sensation, then on those localized areas you can use uh, a commercially available neutralizing agent. Some companies, they do have, for their peels they have that neutralizing agent, but for specific higher concentration peels you need to have a higher concentration of neutralizing agent also. Nothing, जितना percentage, जितना pH का acid है उतना pH का neutralizing agent चाहिए, मतलब counter balance होना चाहिए. So if the pH of the acid is around 4, you need a neutralizing agent at 8 or 9. So it's very simple chemistry. Avoid topical potent steroids. Steroids तो अगर वो लगा रहा है face पे, like anything from mometasone furoate or fusibet, then you need to be careful. If ज्यादा अगर आप देख रहे हो कि ज्यादा redness हो गया है, तो a very mild steroid can be given, like anything like fusibet or HH Fudic, which has mometasone in it, along with fusidic acid as an antibiotic. And sunscreen is very mandatory because the skin after any peel, it becomes sensitive to the sun. Post peel care is very important. First of all, if it is a medium to moderate depth peel, then we need to avoid any kind of soap or any kind of soap or detergent on the face. No soap, no face wash, no night creams. At least till when the peeling occurs. Till the peeling stops, you don't need to use anything. Immediately after doing a superficial peel, that same day and the next day and 2 days prior to that, you need to stop all kinds of night creams. You are supposed to use only sunscreen and moisturizer. What you can expect is depends on what peel you're using. So if you're doing a peel for acne, then you might notice that the acne is drying up. If you have done a peel for glow, then you will see that the skin is glowing, as simple as that. If you're doing a peel for hyperpigmentation, you might notice that the pigmentation gets darker initially and then eventually it starts to get lighter. So what is happening is actually the dark skin is coming to the surface due to exfoliation. So sometimes you might notice that there is redness after peeling, and that redness might last from 24-48 hours anywhere to even 1 week. Slowly it reduces. You might see that there is a lot of hyperpigmentation that comes after peels. That is when the patient avoids using sunscreen, or even after using a good deal of sunscreen goes into direct sun. वो 12 से 3 वाला धूप में जाओगे तो obviously you will end up with sunburns, because the skin that you are forcing to come to the surface is not ready or not keratinized enough to face that radiation. Complication is hyperpigmentation, PIH, or infections or scarring, irritant, contact dermatitis. Contact dermatitis is nothing but irritation. Okay. Post-inflammatory hyperpigmentation is nothing but PIH, or you see the skin getting dark in certain areas. That mostly 90% occurs if you don't use sun protect or you go in direct sun immediately after peel. Infections, if they are underlying like herpes, then it might exacerbate. Or if there are open acne that has just been burst, then it can lead to more acne, because you are adding to the injury, insult to injury. And scarring, if you're using very deep peels and it goes out of your hand, it can end up in scarring. So you need to be careful. Repeeling. How often can you do peels? So the party peels or the AHAs that I mentioned in the earlier part of the seminar, you can use it once a week. You can do once in 15 days also, depending upon what turnover you are expecting from the skin. Medium depth peels, it is better to do once in 6 months. Okay, a yellow peel, usually I do it once in 6 months. Okay, even if there is no requirement, then I don't do it also. So it depends on what kind of patient you are facing. Thank you. I hope you all are not very sleepy.
Absolutely not, sir. It was an amazing session, and like always, I'm very thankful to you for this amazing session. And before taking up the question and answer session, I would like to have your permission to introduce our organization to the participants, sir.
Yeah, sure, sure.
All right. So meanwhile, I'll be requesting all the participants to kindly ask questions in the question and answer box, so that each and every question is taken up and answered one by one.
Okay, is skin moisture tester helpful? By Dr. Sandeep Thadani. You have got many questions. I think you are already into practice. So, moisture tester I am not used. I just go on what I can see clinically. It's very simple. I think Aditi, you need to do this, na? I'll do it later on then. You complete with your introduction.
Sure, sir. I'll be taking up introduction, and after that we'll be taking up question and answer, sir.
Sure, sure.
All right. So this is our organization, Dentist Channel Online, with the motto "Healthy Smiles" and which leads to healthy lives. I will just. So I request all the participants to kindly save this number and send one message with your name on this number, so that you get all the latest updates about the webinars or workshops or whatever we have upcoming, whatever latest updates we have, you will be getting it on WhatsApp. So let's quickly go through the webinars and workshops that we have this week, and for more information you can visit our website events.dentistchannel.online. So tomorrow, on the occasion of Oral Hygiene Day, 1st of August is celebrated as Oral Hygiene Day, and it is our moral duty to educate each and every citizen of the country about the oral health and how it is related to the general health, the overall health of a person. So we have Dr. Samina. She will be talking about oral health, a window to your overall health, tomorrow. So I request all the participants to kindly join the session along with your family members. This is for the general public, this is for all, each and every citizen of India. So I request everyone to kindly join this with your full family and attend the seminar. Okay, so next in the evening we'll be having at 5 o'clock by Dr. Huma on nutritional recommendations in oral cancer prevention, and in the night we'll be having again Dr. Samina on the topic oral health, a window to your overall health. This session will be strictly to the dental fraternity. So if you want to get into a technical information, you have to attend this lecture, and in the morning at 11:30 a.m. you have to attend the lecture with your family members. So now we have this amazing workshop on implantology for beginners, batch 2. Batch 1 we had last year, batch 2 we have this year, this month, 7th and 8th of August and 14th and 15th of August. Timing would be 4 to 7 p.m. in the evening, and for all the details you need to contact on this number or WhatsApp on this number, or you can visit our website events.dentistchannel.online. Okay, those who have not subscribed to our membership by now, I request them to kindly do it ASAP. You'll be getting a lot of benefits with the Prime membership, and it will just cost you rupees 499 for one annual membership. And for more details, you visit our website www.dentistchannel.online. You can subscribe us on Facebook, Instagram, YouTube and Twitter. Now quickly moving to the question and answer session. Alright, so we have a lot of questions from Dr. Sandeep sir. And sir, are you there?
Yeah, I am there.
Okay, so let's take up questions one by one. Question is, which moisturizer to be used after peels?
So you can use from a variety of brands. So there's no one size fit all thing here also. So there are many brands available in the market. You can use something of a combination brand with a sunscreen also. Like you can go for Episoft AC, which is a sunscreen and a moisturizer combined. So they don't need multiple applications. So there's only one thing that you can apply. It's not even very greasy. Uh, there's no addition of oil on the skin. So I personally find it very good. For sunscreen, you can go for La Shield SPF 40, and you can go for Suncross Sun Protect also. Neutrogena is also a very good brand. You can start using that also. Can you suggest some brands of peels you feel good? Uh, so the best brands of peels are Obagi peels, but in India you will find it to be slightly expensive. You can go for Sesderma products. Akar is also a very good brand of peels, and there are many. Aesthetics is also very good. So Mediconcept is also a good brand. So you can try mix and match for other brands also. You need to mostly concentrate on what percentage of peel you're using and the consistency of the peel, whether it is a liquid or a gel based peel. You need to be careful there. Do you
Okay.
always prime skin before peel? Depending upon the skin, if I find the skin to be little sensitive, then I do prime the skin before going in for a deep peel, like Cosmelan uh, yellow peel, where there is a moderate to deep depth of peel. Uh, so you can go for priming of skin. Yes, you can go for hydroquinone creams at night and sunscreen in the morning. And if you have planned a peel, like for example, a month from now, then you can call him weekly and do 4 different types of mild peels on his skin to see if there is any kind of reaction. So it does help.
All right. So last question we have from Dr. Girija. She's asking, can you suggest any neutralizing agent for TCA peel?
For TCA peel, you will find it with the same company that you are using. If you are using a local brand, I would suggest कि वो मत use करो. So there are different brands that are available in on Amazon also. So depending upon the concentration that you are using, अगर 70% concentration है तो फिर उसके मुकाबले to find a neutralizing agent is little tough. Your question is little even outside of my knowledge, whether there is a specific neutralizing agent for TCA peel, I don't know the answer, but I'm sure I can go back and research myself and find out the answer for you.
All right. So I guess we are done with the questions, sir. Any takeaway note for the participants before ending the session?
Be careful, be safe with your procedures. Do not be overexcited by seeing other people's results. Results will come. Uh, try to gain more and more knowledge of a skin as a entity, and only then you can go ahead with peels. So that is my suggestion.
And sir, using your quote again, that be patient with the patient. So I'll like to end this session today. Thank you so much, sir, for being with us for this amazing session. It was very informative, and I'm sure each and every person would be very excited to you have this procedure in their clinical practice very soon.
Yes, thank you.
Thank you so much, sir. Thank you so much. And thank you so much for all the participants for attending the seminar. And I request all the participants to attend our future seminars. And we are hoping to see you soon. And with this, we will be ending the session. Thank you so much. Good night.